Hi, so thank you. As you just heard, I'm Catherine Stables. So I'm a postdoc researcher at the University of Edinburgh, and I'm particularly interested in innovative ways to collect and use data to improve healthcare. So I've worked on a number of digital health digital technology projects with the NHS, and I'm delighted to kick off this evening to talk about the future of healthcare. So, what is the future of healthcare? That is rather a big question. We all know we've got some big challenges. There's growing numbers of elderly people, often with multiple illnesses, and our healthcare system is struggling to cope, so we need to improve it. And I'm going to argue that the way to do that is through data-driven innovation. Data-driven innovation, it sounds very good, doesn't it? But what does it actually mean and how do we make it happen? So in this talk, I am going to talk about what data-driven innovation is, but also, more importantly, how we can make it happen in the best possible way for patients, staff, and the healthcare system as a whole. So I'm going to focus on two specific aspects that I'm personally working on. First, making it easier to securely access data, because you can't do data-driven innovation without data. And this is a project called the Data Lock, which is part of the Data-Driven Innovation for Health and Social Care programme, which in turn is part of the Edinburgh and South East Scotland City Region deal. So it covers Edinburgh, Lothians, and Borders and Fife. But we believe that the solution that we're building and the lessons we're learning along the way are applicable across Scotland, across the UK, and indeed globally. The second aspect, which I'm passionate about, is improving the diversity of people and ideas within the sector. And in this part, I'm going to talk about a grassroots movement called One Health Tech. I am the lead curator for the Edinburgh hub of One Health Tech. We're also setting up a hub in Glasgow right now, and we're hoping to get more hubs across Scotland very soon. So that is an overview of what I'm going to talk about. So let's first of all look at the data access question. I'll start with a very simplified overview of how an individual might interact with our healthcare system. Perhaps they're feeling unwell, so they go to the GP, they get diagnosed with an illness and get some treatment. They're fine for a while, but unfortunately things deteriorate and they end up in hospital. They get some more treatment, but they need some extra support, so social services are involved. And then they're able to go home to recover. So now let's think about how the data flows. Information about this patient is held by each of those institutions that have provided the care, and critical information passes between them, for example, in referral letters, discharge letters, and administrative communications. And this works reasonably well for the individual patient, but it doesn't work very well when we want to improve health and care across the system. So, for example, what could we do early on to prevent people deteriorating to the point where they need to go to hospital? Are there different treatments that work better for different people? The NHS and researchers would love to be able to answer those questions, and indeed the answers are really all there in the data. But at the moment it's incredibly difficult to get those data together. It's not that it's not possible. We have governance and ethical frameworks to work within. Excuse me. We have the secure IT systems in which we can analyze the data. It's just that the current system to get the approvals and actually pull all the data together is so complicated and slow that in the end, a lot of people just give up trying. Even just to say how many people in our region with a certain disease are turning up at our hospitals is actually incredibly difficult in the current system. However, if we could make it easier to look at the data for the whole system, we could answer these questions much more quickly. And there are huge potential benefits to that. For example, we could look for where the inequalities are in the system, and armed with that data, we could go out and fix them. We could identify where there are bottlenecks in the system and intervene to try and reduce waiting times. And every time a care team want to introduce a new treatment or a process or a technology, they could quickly look at the data and evaluate if it's actually helping their patients and how much. To give a more concrete example of that, I work with a team in cardiology who have been studying the introduction of a new clinical test for more accurately diagnosing heart attacks. And they've been able, through this study, to evaluate the implementation of this new test and show that it is safe and secure, safe and effective, and that by changing the clinical pathway through this introduction of this new test, they can show that the people who haven't had a heart attack are able to be reassured much more quickly using this pathway and this test, and sent home more quickly, which is much better for the patient and also for the hospitals. Now, this particular project took 6 years and a huge effort to bring all that data together. So if we can make it easier to do this sort of research, we could, by securely sharing the data between the healthcare providers, we could make projects like this much more efficient and therefore get the benefit to the patient much more quickly. So the next question is, how do we do it? And the key to data lock is that we are making the data defined, linked, and accessible. Now, defined, because there's no point analysing data if you don't understand what it means, you don't know how reliable it is. So we're working very closely with frontline care providers to understand all that data. Linked, by working with the IT teams and the system vendors to be able to actually physically bring their data together. And accessible. Now, this is accessible still within a very secure environment, with tight regulation on access, because of course this is still highly confidential data, and we don't want to change that in any way. But we will do that by working with local data protection officers and Caldecott Guardians to streamline the governance processes that are already there, to make sure that innovators can simply go to a single place to be able to apply for the approvals to do this work. And once their project has been approved, they are then able to access a secure environment to work on that data that they need to address that specific question. So we're doing this across the system. I obviously simplified quite a lot for the purpose of this talk. There are actually obviously hundreds of institutions and systems that hold data. These are just a few. And if we want to improve the system as a whole, we really need to work together. In particular, bringing together health and social care data is extremely important for improving the system as a whole. And again, this of course has to be done with the highest levels of data security and confidentiality. And finally, this should benefit the entire region, and we're working closely with Lothian, Borders and Fife so that we can get maximum benefit for people no matter where they live. Most importantly, all this has to be done in partnership with all the parties involved and in consultation with the public throughout. We are working closely with the Integrated Joint Boards, NHS Lothian, Borders and Fife, the GP local medical committees, I always get that one wrong, and the local councils, amongst others. But if there are other groups who we haven't yet been in contact with, I would say please get in touch. We want to all work together to improve health and social care across our region. And finally, we believe that working like this at this regional level has a lot of benefits, but obviously data lock is also able to inform and feed into the various national programs that exist as well. So, moving on to the second part of my talk, having worked on various innovation projects in healthcare, I know how important it is to have diversity of ideas around the table. And diversity of ideas comes from diversity of backgrounds and experiences of the people involved. The most obvious form of diversity is that of the individual's identities, such as gender, race, sexual orientation, class, and all the ways that all of these different things intersect. However, it is an uncomfortable truth that the system is inherently biased towards people who are white, male, able-bodied, straight, middle class, well-educated, extroverted, and or middle-aged. Now, apart from the fact that I am a female introvert, and we can argue about the middle-aged part, I'm well aware that I tick all these boxes, and I am in a position of huge advantage, but I believe that by letting this system, this bias system continue, we're severely limiting our pool of talent and ideas. So I think it needs to change. I think we'd all agree. Changing it is not just good for the individuals, it's good for the employers too. Research from the world of business shows that increasing diversity of teams increases the quality of the decisions. They make better decisions are made by more diverse teams. And another important form of diversity is in people's skill sets and disciplines or sectors. So in healthcare, it's particularly important to bring together people from the NHS, big companies, SMEs, and academia. So they're not sitting in separate echo chambers, but actually working together to innovate in the best way possible. And of course, involving people with a wide range of experiences of healthcare, of the healthcare system, including and especially patients, ensures that the innovation is beneficial for everyone. So promoting all forms of diversity is the mission of One Health Tech. It's a global, volunteer-led and grassroots community, and we believe that by driving diversity and inclusion, everyone benefits from the best innovation. To give you a bit more information about the One Health Tech Edinburgh Hub, which I am the lead curator for, we've been running for about 1.5 years. We've run 4 events so far. We have a lot more events in the pipeline, including one coming up in December, so check that out. And we actively promote diversity in the way we run our events. We invite, obviously, a diverse range of speakers. We also use semi-structured networking techniques to encourage different groups to mix during the networking. We also have an accessibility fund that can pay for anything that will overcome a barrier to attending our events, whatever that barrier may be. And we also allow, for example, children to attend if you can't get a babysitter. And in fact, I have run most of our events with a baby strapped to me. So we're basically very friendly and welcoming, and if you're interested in getting involved, whether as a member coming to events, sponsoring or hosting an event, or as a volunteer, then please do get in touch. And it doesn't matter on your background, we'd love to have more patients and public people coming along for that kind of diversity. So to summarize, I hope I've convinced you that by giving safe and secure access to better defined and linked data, data lock will help to drive innovation that will benefit patients and our healthcare system. And that the best way to innovate is by working together in diverse teams. That's it. Thank you.